Incontinence is something that many people keep a secret because, who wants to tell their friends that they wet their pants a little bit? But the issue is not discussed when it really should be. And you may be surprised to learn that a physiotherapist can actually assist with this issue. So tell me, what is incontinence to start with, and how common is it?
Okay, so incontinence really means the involuntary loss of urine from your bladder, so having a wee when you don't want to have a wee, losing wees, or bowel motion from your bowel. So that's all part of incontinence. So when you have a little accident with some poo.
Ooh, crap.
Yeah, exactly.
So if you can't bounce on a trampoline, if all of a sudden you've had a little bit of a leakage running to the toilet, or...
That's incontinence.
That's incontinence.
That's incontinence. And what you've described there actually covers the two main types of incontinence.
Okay.
So the bouncing on the trampoline is when it's a stress incontinence, so there's extra stress on the bladder.
Yes.
And having the urgency and running to the toilet is urgency incontinence if you leak on the way.
There you go. So there's two different types of incontinence.
Well, there's actually many types.
Or wee. So I thought it was wee.
No. So that's good to clarify. And a lot of people keep the second one more hidden than even the first one.
I bet. So tell me then, gosh.
How common is it?
How common is it? Yeah. Sorry, I've just got this whole visual now of
you didn't know.
Incontinence. I didn't know.
Yeah, there you go. So incontinence is very common, particularly if we take into account the light bladder leakage, which many people think is normal, and it might be just a few drops. And also incontinence of wind from your bowel. That's actually considered to be incontinence.
My husband's got that.
Yeah, well, a lot of people say that about their husbands. So you're not alone.
I'm not alone.
No,
I'm not alone. See.
Yeah. The Continence Foundation of Australia actually estimate that nearly 5 million Australians have some sort of incontinence.
Wow, that's a lot.
And one of their other stats is that 1 in 3 women who've had a baby suffer from incontinence at some point in time.
Yeah, definitely. Yeah, that baby, definitely. It's our children's fault. That's what my mum says to me.
Well, yeah, that's a tricky one. Does she? Well, I don't know that that's a healthy thing to do, actually. And I don't think we should be blaming our children or necessarily the system. But if because childbirth is actually only one of the risk factors.
Okay.
There's quite a few others. Which are jobs that involve heavy lifting.
Okay.
Over-exercising sometimes. Certain sports lead themselves to incontinence. Obesity, recurrent urinary tract infections. So there's actually quite a few things that can cause incontinence. But one of the most common ones we see is around the peri-pregnant time, when you're either before you have your baby or soon after. And then further down the track, around the time when the hormones change and you hit menopause.
So tell me then, how can physiotherapy help with incontinence?
Okay, so the first thing, that there's some physiotherapists that have extra training in dealing with incontinence as well as other pelvic health issues. And the physiotherapist who has that special training will assess the incontinence quite closely to see where the incontinence fits and how it affects that person in particular. Then there are exercises of the pelvic floor muscles and strategies that people can use depending on how they present that can help them overcome, improve, manage the incontinence. It's not very healthy just to put it on the back burner because it actually doesn't get better on its own. The trend is for it to get worse. And while it might get better temporarily, it might hit you later in life when your hormones change and your connective tissue changes with that, and you're left with problems.
So if you're having any sort of issue, I guess right now, it's go and deal with it now.
The earlier the better.
So
and sometimes it's good just to even be on the front foot and have a postnatal check if you're worried that your pelvic floor is not in order. And when I say postnatal, that might be 6 weeks after you have your baby or 6 years, because it's different for everyone and different people prioritise different things.
So what's the treatment? What do you sort of do in it?
Okay, so within the treatment, after we've done the assessment, part of the assessment would be assessing the pelvic floor muscles, and that's a really big physio area and something that we've developed expertise in. And then we prescribe the exercises accordingly.
Okay.
Yep. And then what we need to do, of course, is reassess, because then we get the evidence to show the patient and to know ourselves that we've made a difference.
Yeah.
Because if something doesn't change, you need to change tack.
I love it. So if there's anything that we've discussed today that rings alarm bells with you, please just know that there's treatment out there. So get in touch with the team at Cairns Pelvic Health Clinic today.